Hi everyone, I'm here with Dr. Terry Grant from Suffolk County, New York, and he has been a geriatric house call dentist for how many years?
Oh my gosh, maybe 20 years.
20 years, me too. I'm much younger than him. Not true. Today we're going to talk about overall dental health, and one of the things that I'd like to focus on, which I never realized was such a thing. I mean, I guess I do it sometimes. I don't even want to admit it. But sometimes we eat before we go to bed. And, you know, if you can't take care of your own teeth, like I get up and brush, but if you can't take care of your own teeth and you've just had like a muffin or ice cream or a candy bar or worse, dried fruit, which people think is good for you, and you've eaten it before you go to bed and you haven't brushed, what happens?
The particles sit on the enamel of the tooth. It starts breaking it down quietly and slowly. So you want to make sure you remove those particles. Sometimes there's a thing we call the 20-minute rule.
20-minute rule.
And that means that you have 20 minutes to remove that debris from what was on your teeth to maintain the gingival health, to maintain the teeth health, to maintain the oral environment of your teeth.
How'd they come up with, like, where did you learn about that 20? Is
That
that
was
a
in
dental
dental
school?
school.
That's in dental school. Oh, that's
school.
hilarious what we remember from dental school.
Yeah.
So the 20-minute rule. And if you don't take off the food and the sugary foods, especially on the
breaking
teeth.
down the enamel.
Okay, and what we see as a geriatric house call dentist is little pieces of the white of the tooth, which is the enamel, breaking off around the gum line. Mm-hmm. And we see that a lot. And then we get called because the patient is sensitive. So let's talk a little bit about sensitivity.
Interesting, with sensitivity, along with what you said, the discomfort is the root cavities that occur. But we try to make sure at the teeth, you have the enamel section, and then you have under the enamel, under the gum, is a cementum layer. We call it that cementum layer. Once that tissue in the ear gum line is removed, that cementum area, oh my God, it's like somebody hit you with a rocket. It sends you right to the moon. Once hot, cold, that sensitivity hits, it's the worst feeling in the world.
Yeah, and we get called about a horrific toothache. The tooth needs to come out, and the good news is, once we get there, we know how to fix it, and the tooth is going to be just fine.
We save the tooth. Save the tooth.
We save that tooth with a filling. Sometimes we use silver diamide fluoride, the arrest treatment by Elevate. We go in there and we stop the decay. You know, it's difficult, especially with the dementia patient or the Alzheimer's patient.
Sometimes because the Alzheimer and dementia patient can't tell you where the discomfort is coming from.
Right.
And you have to look at that and see for yourself, and you have to be them and make sure that you're treating them as if it's your mouth.
So one of the ways that you know that they're having pain is they'll stop eating, or they'll wince when something goes in their mouth, and sometimes they'll even hold their face. Those are the clues for the dementia patient and the Alzheimer's patients that we know they're having pain. So we talked about eating in the bed and not brushing. We talked about sensitivity. Do you recommend any products for sensitivity?
Sensitivity, I'm a fan of GlaxoSmithKline.
You are?
And I love Sensodyne toothpaste.
Do you? Well, I'm a big fan of Closis, and all of their toothpastes are for sensitive teeth. So we all have our favorites. I actually really have a lot of patients that have sensitivity on all of their teeth. So that's a clue that either they're brushing too hard, which is another issue, or they've caused damage either by decay or by brushing too hard. So the sensitivity, the toothpaste really do help. What other concerns do patients call you with the most when you get a call that have to do with pain?
Hot and cold, discomfort in areas where they can't reach.
Right.
When they're brushing.
Right.
We try to show techniques to the patient and to the caregiver of close the mouth down a little bit so they can get the back of some of the teeth.
Right.
Because that mandible is blocking to get back in those areas.
So home care is really important, and we go in and we actually teach the caregivers how to brush the teeth, what to look for. And I like to give them a little dental lesson, like if I'm watching a tooth, that they need to look to see if there's any swelling or changing in eating habits. And we're here for you. The questions, you're not a dentist, we're the dentists. So if you have any needs, you have any questions about your loved ones, mouth or oral care, give us a call,
Yeah.
and
Be
we will
happy
come
to
out to
provide
your
you
house.
service.
So thanks for listening.
Thank you.